The National Bureau of Statistics has launched the 2021 Multiple Indicator Cluster Survey and National Immunization Cluster Survey. The Statistician General of the Federation and Chief Executive Officer of the National Bureau of Statistics, Prince Adeyemi Adeniran, made this known while addressing newsmen at the launching of the survey in Abuja. Adeniran says the data covered in the survey includes data of out-of-school children, early marriage, child labor, energy consumption by households, food security, and female genital mutilation. He says that the data collected will help the federal government in understanding and planning, which will help improve the living standards of Nigerians.
The SDG is a work in progress for us in Nigeria, but we are making progress and we are not deterred and we are moving forward. Not only this, we are also looking at the education side of the children. The attendance, net attendance ratio is calculated there. When you talk of dropout rate, it's also there. The out-of-school children, the number is calculated so that government can plan and make sure those that are not in school are brought back to school. If you talk about women, we have female genital mutilation covered in the data. We also have gender domestic violence also covered in the survey. That is for children, that is for women, as well as our adolescents. When you talk about child labor, the survey covers it. When you talk about early marriage, those children that marry before the age of 18, we have the data. These are data that SDG is looking to cover. And this is the data required for the government to assess our performance in terms of SDG. When we talk about environment, energy use is also covered in the household questionnaire. We also have data on we have data from household on food security, which is very, very pertinent and very important for government to plan now, especially given the war between Russia and Ukraine, which has distorted the logistic for distribution of food items.
The United Nations 2030 agenda and its attendant SDGs. It will help the governors to assess their own progress and use the data to inform decision making. But most of all, it will benefit the Nigerian people and their own development aspirations. The United Nations aims to be more transformative and catalytic in nature, to help Nigeria move that needle to achieve far greater impact in its own developmental aspirations. Good information and data is vital in this pursuit.
We've worked very intimately with the Director General of the National Bureau of Statistics. Even at the height of the pandemic, we toiled night and day to make sure that every barrier was overcome to make sure that this data is presented to Nigerians, because it is this data that tells us how well we're doing. It is this data that forms a benchmark between our vision and what we're able to produce. In the last couple of years, we've seen how working with frontline health workers, we've been able to bump immunization rates from 33% to 57%. All of this happens because of the intricate plans that have been made at the federal level, working with stakeholders, our development partners, community-based organizations, faith-based organizations. But all of this wouldn't have been possible without the leadership provided by President Muhammadu Buhari. This is why, apart from the multi-cluster survey that we do, we made a particular provision for immunization data, because immunization is the entry point to all primary healthcare services. We've compared this across board with what happens globally. Only a few days ago, we received information that from a global perspective, Nigeria is one of the few countries where the global pandemic had very little impact on immunization coverage. That means that despite all of the barriers to accessing primary healthcare services, Nigerians still were able to take their kids for vaccinations, and health workers were there to give them these services. These health workers are the most important part of the primary healthcare space. We have tall dreams for primary healthcare, but unless and until we address the issue of inadequate human resources at primary healthcare, we'll keep moving around in circles. 57% is a great leap from 33%, but Nigeria can do better. But for us to do better, we have to work with the subnational level to address challenges such as only 27% of our primary healthcare centers countrywide have the right complement of human resources. We cannot jump to 80% or 90% until we address this.
It is instructive to state that improving the survival rates among children depend on their access to routine immunization. Despite the tenacity of the primary healthcare workers conducting routine immunization across the country, we still have low immunization coverage, with the largest proportion emanating from the northern part of our country. There has been conspicuous improvement in the coverage from 34% in 2016 to 57% as reported in the current round of the MICNICS survey of 2021. The target is to ensure that every child benefits from life-saving vaccines across the 774 local governments in the 36 states and FCT. The outcome of this report will enable government to re-strategize and scale up vaccination efforts to ensure total coverage of the entire population in need. I want to assure you that the government of Nigeria will continue to strengthen all sectors of the economy to ensure a balanced development both at the national as well as at the subnational level of governments.